The method we'll show here is Dr. Still's relatively well-known and reproduced method for setting a hip. The one in supine, he does talk about one in seated, but which is essentially the same thing, just in seated. And you put the good hip against the wall and the bad hip free so it can move. Essentially, all you're doing is a relative straight leg raise and pushing the leg across. You do, as with everything else, have to pay attention to bind and barrier. I've misinterpreted this before because it talks about bringing the knee towards the chest of the hip that you're working on, or the thigh. And the preceding portion of it does talk about a relative bend in the knee, so it's not really a straight leg, and it's not really a bent leg. It's kind of in between. So as you pick it up, you're going to let it bend. You use your torso. Dr. Still does talk about using his chin, but you know, that's a little weird, so we won't do that. But the abdomen against the lower limb allows for some control. If you are considering the size of your table, the position of your table, the ability to push across is minimal because I run into the table. So one of the adjustments that you'll want to make in a lot of cases is to actually get your down table leg on the table, because now I can go way farther. So the table's not in my way, at least not in one of my legs' way. The up table hand is going to go on the trochanter or in and around the trochanter. So you get a short lever lift like this. With respect to the traction that Dr. Still talks about, you can do it with your arm, or you can just kind of turn your torso down the table and you get the traction. If I'm lazy about this, I can just make it look like that, right? If I'm paying attention to bind and barrier, we're going to get this way over until I get some bind in my hand, in the hand around the trochanter, and then I'm going to pull with that hand. So now the pelvis is rolling, so it's not really the hip anymore, but it really allows me to get more force in there. Then I use the traction. I kind of lean down the table, lean towards the foot of the table, and then that would be the method. But the problem is, with my knee, I'm going to kind of get my knee out of the way to do it. So it gets a little bit more involved, but it's because of the width of the table. It's because of how far you can lean. As with anything else, you have to pay attention to bind and barrier. But that is the method. Again, keeping in mind that when I've shown it before and when I've seen other people show it before, they have a much more bent knee. But in this case, he wasn't saying a heavily flexed knee. He was saying a lightly bent knee, or lightly flexed. There you go.